Well, hello there. I just wanted to have a little bit of a feedback on my IDD session that I had at GW Osteopathy. So I had an accident about 9 months ago where I was pulling a big trailer full of logs and I damaged my back. I had an MRI, full spine MRI, and it showed that I got two herniated discs, two slip discs around the bottom of my spine, L4, L5 and L5, L6. So I had two spinal injections, which helped at the time, but within a few days they'd worn off and not helped anymore. I saw a surgeon who said, not sure I want to operate because it's not really that bad. It was quite bad, but it just didn't show it when I was lying down or sitting down. I saw a second one who said, yeah, I understand what the problem is. It's much better if it can heal, because it can heal on its own, but just let it go and see what happens. So I let it go for about sort of 7 months. It got better to a point, but not much, not good enough, and I couldn't run and I couldn't do much standing because I was in a lot of pain. So I looked into osteopathy and decided that I would like to give IDD a try, because it seemed to be quite a sensible approach, opening up the spine, and the research I did was that it certainly never caused any problems, it never had any negative effect, but it wasn't proven to have a positive effect. It was individual, some people it did, some people it didn't. So no downside really, and pretty good value for money for what was going to happen. So I thought, okay, I'd look at that. So I went to see Gemma at GW Osteopathy, and she explained it all to me. I saw her colleague Paige, she explained it as well. And that led to me booking 10 appointments to have IDD. Which I had sort of roughly every other day. Sometimes there's a little bit longer gap, and that concluded just after Christmas this year, so 2018, last year I suppose, just after Christmas, and it was a really good experience. I must say, I was not expecting it to be. I was rather sceptical because it's difficult being a new technique, that there's not a lot of scientific proof behind it yet, because it's new. But it worked really well, and so I would thoroughly recommend trying it, because I say it has no potential downsides. It's very good. So what happens is you go in, they ice your back initially, just with a little ice pack on the back you hold on. Start with a heat pack. Put the heat pack on your back, warm up your back a little bit. Then you lie on the machine that pulls a gentle stretch on you, and it oscillates. Pulling harder and slightly looser, and then it backs off a bit, and then it does that again, and it does that for roughly 10 times. And by the end of it, the machine then moves from horizontal to vertical. You come off it, and then that's when they ice your back, just with a little ice pack for 4 or 5 minutes. No pain at all. It doesn't. The whole process doesn't hurt at all. In fact, it's rather nice. It's like having a stretch, just like you stretch any muscles. Really good. I found initially it didn't really make much difference. Once I got to about the 5th one, then it really started making a difference, and I could feel the difference in my back. The numb foot from the slip disc had gone. The sciatic pain down my right leg, which was the main problem I was having, had gone, and I could stand all day, and by the end of the day I was in a little bit of pain, but not very much. As I went through more sessions, and the weight and the pull increased up to just over half my body weight, it got better and better and better. I had a slight amount of back pain at about number 7, but I mean it was very minor, and with a day that had gone, and I think that's just because it was pulling the soft tissues about further apart than it had before. So with some heat on that and some chilling as well, some icing on that went away, and then from 8 onwards I had no more pain, and finished all 10, and now can do what I like. I'm not running now. I'm still letting it gradually recover, because I don't want to exacerbate it now that it's better. I'm doing lots of cycling, which I find really helps, because it opens up my back. And I would say to anyone thinking of IDD, give it a try, because surgery is a really bad option, because there's all sorts of things that can go wrong with it. Whereas this, worth doing if it works for you, which it did for me. Really good. I thoroughly recommend it. GW Osteopathy, great people. I have no connection to them. I just think they work really nicely. They were very honest. It's a good location in Guildford. It's easy to get to, lots of parking. So give them a call, give it a try. Hope you get better like me.